Assalamualaikum, Smina, and a very good morning to everyone. I'm Rafidah Atan. I'm an intensivist, and I'm the current head of Department of Anesthesiology, Faculty of Medicine, University Malaya, and I'll be moderating today's session. I would like to thank everyone for joining us for this breakfast at UMHealth session today. So tomorrow is a very special day for anesthesiologists around the world, as is the 16th of October is the World Anesthesia Day. Now, the day is important to us because it commemorates the first public demonstration of the use of ether anesthesia in 1846 by W.T.G. Morton at Massachusetts General Hospital. And that was a moment that transformed patient care and saved surgery forever. Now, this year's global theme, which is anesthesiology in health emergencies, reminds us that our specialty extends far beyond the operating theatre. We are frontline responders in crisis all over the hospital. We are also responders to crises in the world, like in the not too recent pandemics. So we play a role in not just in perioperative emergency, but also intensive care, and we are leaders in patient safety, and we are excellent system builders. With that, we help to shape further safer pathways of care. Now, with that in mind, today's topic is highly relevant. Digital dashboards are not just technological add-ons. They are also part of how we prepare for healthcare emergencies. So it is my absolute pleasure to introduce our speaker, Associate Professor Dr. Chaw, who is the consultant anesthesiologist with a subspecialty in pediatric anesthesia. She is a member of our department, which is the Department of Anesthesiology, Faculty of Medicine, University Malaya. And she's actively involved in clinical work, teaching and research. And her research interests include population pharmacokinetics, which is part of her PhD work. She also has expertise in machine learning, perioperative pain, and pediatric anesthesia, making her ideally positioned to lead today's discussion on developing an automated critical incident dashboard for pediatric anesthesia. Now, as part of housekeeping announcements, can you please write down your questions through the Q&A box, and we will try and address them after the talk. So with that, I would like to invite Dr. Chaw to take the session forward. Chaw, please proceed. Thank you.
Good morning, everyone. Thank you, Prof. Rafidah, for your kind introduction. Thank you for joining us today. As mentioned just now, tomorrow, October 16, is the day on which we gather to celebrate World Anesthesia Day. This day is a defining moment in medical history, which, as mentioned, the first successful public demonstration of ether anesthesia in Massachusetts General Hospital in Boston. And these events changed the course of surgery, transforming pain into a manageable condition and established anesthesia as a cornerstone of modern medicine. Each year, this day is more than a commemoration. It's a reminder of our collective responsibility as an anesthesiologist to advance patient safety, innovation, and preparedness in the face of evolving healthcare challenges. So each year, this is the day we celebrate with our fellow colleagues locally as well as internationally. This year, 2025 World Anesthesia Day theme is anesthesiology in health emergencies. It highlights our vital role beyond operating theatre. We are not only the guardians of airway, but also the first responders in crisis, whether in a mass casualty event or pandemic response, and resuscitation in resource-limited environment, as well as managing intraoperative crisis in vulnerable population. Health emergency review how fragile safety system can be and how critical our ability to anticipate, to respond and learn from incidents in real time. In this situation, a timely data, situational awareness, and organized response system make the difference between a chaos and coordinated care. With that in mind, my presentation today, developing an automated critical incidents dashboard for pediatric anesthesia, reflects the same principle of preparedness and resilience. While it focuses on routine perioperative care, the underlying message is universal. First is to respond effectively to emergency. We must first understand where the risks occur, and we need to build a system that learns from incidents. So as we celebrate World Anesthesia Day, let's not look back at 179 years of innovation, but also to look forward to a future where digital tools, data-driven, and team learning keep our patients safer. With that, let me take you through how our pediatric anesthesia critical incident dashboard is developed and how it is helping us to strengthen safety in everyday practice. So in the next 20 minutes, I'll walk you through 4 parts of the presentation. First, the background and history of critical incident reporting, the milestone in the pediatric anesthesia reporting in UMMC, and how we develop the automated dashboard, and what are the benefits of dashboard for clinical practice and quality improvement. The concept of critical incident reporting dates back to 1954, where Flanagan first described the critical incidents reporting technique to enhance military aviation performance and safety. Since then, this process of incidents reporting and analysis have been well established in multiple high-risk industries, including aviation, anesthesia, and etc. The underlying principle remains the same today, which is identify, report, and analyze the untoward event that could lead to patient harm. In anesthesia, we know how critical it is to learn from near misses, not just adverse outcomes. So critical incidents is defined as untoward and preventable mistakes leading to or potentially leading to adverse outcomes. And reporting them is one of the cornerstones of risk reduction in healthcare. As the principle is simple, we reduce risk by learning from what went wrong. And it promotes transparency and proactive prevention, which is the key component of safety culture. However, when it comes to pediatric anesthesia, the stakes are even higher. Children are physiologically vulnerable, in which a small error, a delayed response, and inappropriate dose can lead to a rapid deterioration. Their care requires a teamwork, and sometimes in high-risk case, a specialized pediatric anesthesia care team. That's why establishing a structured reporting system is essential, not only to capture the incidents, but to understand the patterns unique in pediatric care.
Chaw, I think we lost your slide. Do you want to check that you're sharing?
Okay. So the field of critical reporting in pediatric care started since 1990s. It moved from a narrative incident report towards pediatric specific registry, which reported perioperative arrests. Followed that, several other registries were established in other regions, such as the Wake Up Initiative, which served as a QI registry. And later, a multinational prospective benchmarking, such as Apricot, was conducted. So the latest 2020s, the global perspective of WSA shows a persistent higher perioperative cardiac arrest for children in low or middle income settings, and this support a localized reporting system and near real-time feedback tools. Back in UMMC, our journey in pediatric anesthesia incident reports started in 1996 with paper-based reports. These early forms were often handwritten, reviewed retrospectively, and manually tallied. It is useful but very time-consuming. In 1998, we transitioned to an online system using RECAP. It is an online platform with a standardized data entry and make tracking easier. And it is easily accessible through QR with any devices. This screenshot shows part of the survey of these critical incidents in our setting, which is very easily administered. This marked a huge step forward, enabling a structured data capture and cumulative analysis over time. Then starting in 2023, we introduced a monthly CME sessions focused on critical incidents. And each sessions provide a platform for reflection and shared learning. So the goal remained clear: to identify a frequency and characteristic of incidents in our own setting, its primary cause, contributing factors, and what are their impact on patients' outcomes. So this consistent reporting and discussion process led to the foundation for our current project. This shows our previous format of monthly CI reporting, which was limited to a simple descriptive statistic to illustrate the total cases and as well as the incidents. Despite these advances, we found that traditional reporting systems have many limitations. They are underutilized, often retrospective, and depends heavily on manual data extraction and static summary tables. These methods do not lend themselves to timely pattern recognition. For example, like if an airway incidence increase over several in a short periods of time, we might not detect them until the next audit cycle, signify a missed opportunity for early intervention. So what we need is a real-time visual system that could provide an actionable insight at a glance, and that led us to develop an automated critical incident dashboard. So this diagram shows the overview pipeline of developing the automated dashboard, and I will walk you through each steps. So it started by strengthening our critical incidents registry within RECAP. This registry serves as a single source of information for all the cases reported by our clinical staff and trainees as part of our quality assurance process. Using RECAP's application programming interface or API, we extracted data directly into RStudio. And this snapshot shows the raw data extracted from the RECAP, which we can see that the structure of this raw data is very messy and it is very difficult to analyze. We move on to develop script in R. First, to clean the data and then to transform it into a structured data format. The structured data is standardized and export automatically to Google Sheets, which function as a live dataset for visualization. This integration ensures that the new incidents that is entered into RECAP are reflected into the dashboard without manual intervention. This shows part of the R script that we developed to extract data, to clean the data to a more structured data set and uploading it to the storage. The visualization layer was built using a Google Looker Studio. It is a cloud-based platform for interactive data exploration. And this dashboard is dynamic and enables a real-time analysis of key metrics, including the top incidence types, for example, airway, respiratory complications, cardiovascular or medication error. Second is the demographic risk factors of patients that is involved in our care or involved in critical incidents. And also we show the time trend allowing users to filter by dates or by patient's characteristic. So with this dashboard, each parameters which previously hidden in the audit tables is now visually represented. This slide shows that our dashboard features the 4 main points of the of this project. First, to track critical incidents by category. Category means the types of incidents. We highlight the trends by year or monthly trend of critical incidents, as well as filter critical incidents by pediatric specific classification, such as ASA, physical status, or patient age, etc. This also allows us to benchmark with other statistics, such as the apricot studies. This is the first page of our dashboard. We compare the critical incidents in local setting with the apricots to allow benchmarking and set as our target or what are the aim for improvement. So the trend and months with the highest incidence happens is also demonstrated in this page, and we can filter by years to look at the trends over years and over times using slices of the Looker Studio. The second page shows the most common type of critical incidents, and the users can look into the CI based on patient demographics, and we could identify what are the patient groups with the highest incidence or higher prevalence of critical incidents. And we could also use the slice to filter the data that we would like to explore. This page is a dashboard that allows us to look into individual critical incident case in a more detail via a table view. So by clicking on the bar chart of the months, we could look into each cases that happened in that month. And by clicking on the top row of the bar chart. So it helps us to identify the key error that we need to focus on in terms of learning and identify issues in our daily practice. We implemented this dashboard and learning process in this year within our Paediatric Anaesthesia division, and it is reviewed monthly alongside with the CME sessions. The dynamic format can enhance interpretability compared to the static reports and support a consistent data analysis and foster proactive safety culture. Our team could easily track recurring issues and design targeted interventions appropriately. So what are the benefits of an automated critical incident dashboard? This dashboard has changed how we engage with safety data. First, it enhances timeliness. An automated data refresh daily eliminates lag between incidents occurrence and visibility. This supports a rapid feedback to clinical teams and promote a learning system models. Secondly, it promotes accuracy as the data is now standardized and updated automatically. Third, support benchmarking and research, which allow local, national, and international comparisons and provides a structured data set, potential for quality audits and predictive analytics for risk stratification. The system enhances efficiency reduce the time needed for audit preparation. It streamlines collation, analysis, and reporting, replacing the static Excel reports indirectly. It frees clinicians to focus on improvement rather than data entry alone. So most importantly, it supports a learning system, one that moves from reactive analysis to proactive prevention. So in summary, our automatic data dashboard bridges the gap between data collection and data utilization. So it transforms it into a real-time analytics and driving situational awareness, decision support, and quality improvement. Moving forward, we hope to expand the dashboard to other subspecialty and integrate automated trend alerts and to link outcome with training feedback loops. So learning is continuous and embedded in daily practice. So this work was made possible by the dedicated pediatric team in Department of Anesthesiology, led by Prof. Ina, contributions from Dr. Kevin, Dr. Mok, and Dr. Yu Xiang, Vinod, and Miss Aina, who is the undergrad elective student, who help us together design the dashboard, and all our master trainees to consistently report and discuss and learn from these incidents. Thank you for your attention, and I hope this presentation has shown how automation and visualization can strengthen safety system in anesthesia. So I welcome any questions or thoughts on how we can continue improving this shared journey towards a safer care. Thank you.
All right. Thank you, Chaw. That was very impressive and very insightful and forward-looking. I can see that I cannot see any questions being posted. I'd like to remind the audience to please post any questions that you may have. Yeah. But meanwhile, maybe let me just try to understand just a bit more. So, Chaw, how do people gain access to this dashboard, and who can actually look at it?
So far, the dashboard is restricted to the pediatric team for monthly CME learning.
And it is actually to access it. What is the platform that
The
you
Lucas
use?
Studio, which is quite an easy to use platform. We can we shared the link to access to that dashboard to specific team members.
All right. And then when you develop this dashboard, for anyone who's looking at, trying to come up with something similar, what may be advice or what kind of support do you think they would need, and or skills, or if they don't have so you all did this in a way your own team?
Yeah.
Okay. Yeah. So if people
together.
Yeah. So if people would like to develop something for their own system.
The Lucas Studio is user friendly. The other one is the recap system is the survey form which the clinicians in practice have to key in the data. Otherwise, the R script is the one that is more challenging. But with the template that we develop, it is actually easily modifiable to fit the needs. It can be amended to fit the needs of each specialty.
Okay. Yep. All right. So, okay, Shazwani basically has asked also about whether the dashboard design is difficult, and you seem to have, maybe you could summarize that, Chaw. And is also asking whether, did you have to, are there any costs, that you had to expend in order to create this?
The cost?
Did you find it difficult to design the dashboard?
The designing is not difficult. It's actually drag like you want a table, you drag the table, because the design this Lucas Studio has all the functionality of dashboard. So we can just, if you want a bar chart, you just drag the bar chart into it and specify where is the source of data into the tables. Like I want to get the data from this table, we just specify it into the columns and it will generate. And then we put in slices so that it can be more it is dynamic and interactive.
So
Like,
you can design your own dashboard, but is it free? All these things that you use, are they free or any cost
Local Studio
involved?
is free. Local Studio is free.
Mm.
And R is a coding. It is open
Open
source,
source.
so it is free. Just that it needs to learn the R code in order uh because mainly it's the R code that run the background.
Right. Okay, any other questions from the audience? So actually it requires so you're saying the resources are actually all available. Is you need the skills and the and all that is actually you can learn as well. There are courses being offered for people to learn how to use it, right? Chaw?
Yeah.
Yeah. Okay.
This is
Okay. So yep, so there's a okay. So Iftita has got a question. Is it Iftita from Toronto? Okay, so there is a more detailed information about the cases that are considered events. How about data protection in these cases? Yeah.
Sorry, I can't see the questions.
Okay. So what Iftita has written is that there is more detailed information about the cases that are considered events. So how about data protection for these cases?
From the local, we actually anonymous. The table is just characteristic of the patient, but there's no identification of the patient because it is a dashboard. However, if you want to look into the details, our team will assess individually. So it is not open to others.
Yep.
It's all anonymous.
Okay. So meaning the details of if you discuss it during the M&M, that will be a very close discussion within a very close group of clinicians who are involved with the care of the patient. And that's how, yeah. I hope that answers your question, Iftita. Any other question? We got maybe another 1 minute left before it's 8:30. So what's the future? How do you move forward from here, Chaw? And what advice have you got for the rest of us?
I think it is a very good visualization, very good utilization of visual analytics in order to help us closely. So for us, we closely monitor because we just need a click to assess to know what is happening on the ground. I think this could be expanded to all the general anesthesia cases so that we could learn in a timely manner. And it is not with the template that we have, we can, I think is easily modifiable.
Okay, so I think it's 8:30 now. So I would like to thank Chaw again. Thank you. That was very impressive and well done to the pediatric anesthesia team led by Prof. Ina, right? And as we approach the World Anesthesia Day tomorrow and reflect on this year's theme, which is anesthesiology in health emergencies, today's session has reminded us that innovation is also part of our responsibility in safeguarding patient safety, especially in vulnerable populations like children. So to everyone who joined us this morning, thank you for being part of this academic exchange. We hope more discussions like this because your sharing has inspired the rest of us to further improve our care. And for anesthesiology itself, it will help to push our specialty forward, not only in clinical excellence, but also in system preparedness and digital transformation. With that, we conclude today's Breakfast at UMHealth session. Have a good day ahead, everyone, and happy World Anesthesia Day in advance. Thank you.
Thank you.